The widespread distress caused by the COVID-19 pandemic has elevated in the past few months due to the extended lockdown and the rise in number of positive cases and fatalities. Coordination, cooperation, and collaboration are the key words as the different sectors come together to overcome the prevention infested by the novel coronavirus. The social, economic, and psychological impact of the prevailing COVID-19 situation has been the most devastating on the majority population of India that belongs to the rural and migrant communities. BAIF, in partnership with multiple corporate, civil, and government organizations, has been able to extend COVID relief and response measures across 12 states of India. Rajasthan, Orissa, Maharashtra, Gujarat, Uttarakhand, Andhra Pradesh, Jharkhand, Madhya Pradesh, Karnataka, Telangana, Uttar Pradesh, and Bihar. We have implemented dedicated stages of action to leverage our 5 decades of experience and outreach of about 4,500 livestock development centers and over hundreds of livelihood project offices in villages across India. Biofield teams have conducted surveys and field assessments in cooperation with local governments and community representatives. We have reached out to millions of people in the continuous efforts to spread COVID-19 awareness and sensitization. Biofield teams have facilitated pieces of training and sensitization programs successfully through the cooperation of local cadre in villages that were beyond reach. These community cadre, developed through various BAIF projects, have proved to play an important role during the crisis and for the sustainability of the interventions. Our local staff has also facilitated linkage of villages to direct benefit transfer, government schemes, and the newly opened collection and marketing centers by the government. BAIF's IT team is developing the BAIF Parivar app to provide technology-enabled communication contents, actions, and its dissemination to ensure last-mile reach. We aim to reach 10 lakh farmers directly who are part of the BAIF's data coach. COVID-19 has severely affected the livelihood of landless, marginal, and small farmers. According to a survey conducted by BAIF, covering a total of 97,806 families in 250 villages, it was found that 13% of families are landless and 62% of families have less than 5 acres of land. Only 19% of families own more than 5 acres of land. The importance to create local livelihood opportunities for the migrant in the villages is the need of the hour that arose from the crisis and implores to be addressed immediately. BAIF plans to restore livelihoods through multiple efforts under its various projects. BAIF field employees are helping the local communities to overcome the financial crisis suffused due to the pandemic by suitable employment opportunities. Women self-help groups across India are involved in activities like mask production, mushroom cultivation, and sale of local produce. Women are playing an important role as EDO's digital service providers to remote tribal villages of Maharashtra. EDO's services comprise of financial services, life skills, surveys, mapping, e-governance, literacy and education, and value chain and e-commerce. Farmer producer organizations are given the necessary support from biofield officials to harvest and sell produce while adhering to the COVID-19 guidelines and precautions.
फिरोजाबाद है, मैं गांव आगुचा से हूँ और मैं एक किसान हूँ। और जो अपना देश में बाहर जो बीमारी चल रही कोरोना, वो ये मतलब काम करते समय दूरी बना रखनी चाहिए और अपना अपना साधन अपने साथ में रखना चाहिए और मास्क लगाना चाहिए, हाथ में ग्लव्स पहनना चाहिए और अपना जो साधन है उन्हें हर 2 घंटा में धोना चाहिए। और मतलब कृषि विभाग के हिसाब से एक ना रखनी चाहिए, 1 या 2 मीटर की दूरी बनाकर काम करना चाहिए और अपनी सावधानी अपने हाथ में है।
Vrindavan Agri-Horti Producer Company Limited, BAPCOL, has helped BAIF project farmers in the sale of their produce to secure their livelihoods by connecting them through Feed the Hungry and Farm to Kitchen initiatives. We are thankful for our supporters and sponsors during these afflicting times and look forward to tackling the COVID-19 crisis and its after effects with collaborative efforts in the path towards relief, rehabilitation, and innovation.